Welcome to the Ortho Reports podcast. It's interesting. Sometimes the most common, everyday medical procedures are the ones hiding a huge debate, a place where surgeons have to make a really tough call between two good but competing options. Today, we're going to dig into one of those debates, and it all starts with one of the most common injuries of childhood. All right, let's get into it.
Picture this. It's a scene pretty much every parent has imagined. A kid is on the playground having a blast. They take a tumble and land, bam, hard on an outstretched arm. Now, most of the time, thank goodness, it's just a scrape or a bruise. But sometimes, it's a lot more serious.
And that brings us right to the injury at the very heart of our story today. The official name is a supracondylar humerus fracture. And trust me, it's something pediatric orthopedic surgeons see all the time.
So what are we talking about exactly? Well, it's a break in the humerus, that's the upper arm bone, right above the super delicate elbow joint. And this isn't some rare thing. The source material we're looking at confirms this is the single most common elbow fracture for kids, especially those between 5 and 7 years old.
And get this, a whopping 98% of these breaks happen exactly like that playground scenario we just talked about, a fall onto an outstretched hand. It's an almost universal cause for a very specific injury. But how you fix it, well, that's where the story gets really interesting.
For the really bad breaks, surgery is the only option. And this is where surgeons face a critical choice. It's a true dilemma, a high-stakes balancing act between getting the most stable repair possible and guaranteeing the absolute safety of the patient.
Okay, so this slide lays out the two main schools of thought perfectly. On one side, you have cross-pinning. Here, surgeons put pins in from both the inside and the outside of the elbow. For a long time, this was seen as the gold standard for stability. But, and it's a big but, it comes with a serious risk. On the other side, you've got lateral-only pinning. All the pins go in from the outside of the elbow. This is way safer for a really important nerve, but the question has always been, is it actually stable enough to hold the bone in place?
And right here, this quote gets to the absolute core of the debate. That word, idiotrogenic. It's a medical term that basically means an injury caused by the treatment itself. With cross-pinning, there's a known risk of accidentally damaging the ulnar nerve. That's the nerve that gives you that horrible funny bone shock when you hit it. Except damaging it here is no laughing matter. It can lead to real long-term problems with feeling and movement in the hand.
So, with the stakes this high, you can't just rely on tradition. You need cold, hard evidence. And that's exactly what a group of researchers in India set out to find. They designed a study to put these methods head-to-head and finally get a clear answer.
So what did they do? They enrolled 60 kids, all of whom had the specific kind of severe elbow fracture, one bad enough that it needed surgery with pinning. This gave them a really solid group to start looking for real, meaningful patterns.
And here's where the study gets really smart. They didn't just compare option A to option B. Nope. They split the 60 children into 4 different groups, with each group getting a slightly different pinning technique. This lets them build a much more complete picture of what really works best.
So these were the 4 contestants, if you will. You have the classic cross-pinning method, then you have 2 different kinds of the safer lateral-only technique. Divergent, where the pins spread out for a wider grip, and parallel, where they run side by side. They even tested a 3-pin variation. And by the way, when they say K-wires, just picture thin, stiff metal wires that hold the broken bone pieces together so they can heal. It's a really thorough comparison.
But through all that complexity, the main goal was beautifully simple. Just one objective, really. Find a technique that's the absolute safest, the one that avoids nerve damage without sacrificing the stability that kid needs for a perfect recovery. All right, so they ran the study. They followed the kids, they collected all the data, and the results, honestly, they were fascinating. They ended up challenging a really long-held belief in orthopedic surgery. Turns out that old conventional wisdom might have been wrong all along. Okay, just take a look at the data in that excellent outcome column. The traditional, riskier cross-pinning method, 82% excellent outcomes. Not bad at all. But then, look at the lateral divergent method, one of the safer options. It actually had the highest rate of excellent outcomes, at 94%. The truth is, they all performed incredibly well.
And here it is, the scientific knockout punch. After they ran all the numbers and did the statistical analysis, the researchers concluded that there was no statistically significant difference between the groups. In other words, that long-standing fear that the safer method wasn't as stable, the data just didn't support it. They held up just as well.
So the bottom line was just crystal clear.
This study provided powerful evidence that surgeons don't have to make that trade-off between safety and stability. They can choose the path that completely avoids the risk of nerve damage and still expect a fantastic result for their young patients.
So what's the big takeaway here? Why does this one study matter so much? Well, it all comes down to patient safety. It's about giving surgeons the confidence and the evidence they need to choose a technique that avoids the potential for a life-altering complication.
And the paper itself sums it up perfectly in its clinical message. This isn't just some interesting academic finding. It's a direct, practical recommendation. Lateral-only pinning techniques are a safe and effective alternative. They slash the risk of complications without sacrificing the quality of the repair.
And really, that's what great medical research is all about. It's about testing our old assumptions, filling in the gaps in our knowledge, and giving doctors the data they need to make the best possible choices. For any kid who has this awful injury, this research points the way to a safer, more certain recovery.
And that leaves us with a final, bigger thought. This entire story started because doctors were willing to question a standard routine procedure. They asked, is there a better, safer way? It really makes you wonder, what other common practices out there could be improved if we just step back and have the courage to put them to the test? Thanks for joining us on the Ortho Reports podcast.